Good morning, everyone. This is part 2 of a video about mastitis at Christmas. And mastitis is inflammation in the breast that can be very painful and very exhausting and very discouraging. So in my previous video, I just talked about why is it such a thing at Christmas? And now I want to talk about if you think that's happening, what you should do. So it's really worth knowing that the advice about what to do has changed. So in 2022, there was new guidelines brought in about what you should do if you think you have mastitis. So here's what you should do. Consider taking ibuprofen if you can tolerate that, because it will help with the pain and it also brings down inflammation. You can consider applying cold to the area to see if that makes it more comfortable. You should rest. I know, rest, at Christmas, but anyway, rest. And what's the other one? I've remembered. Oh, I'm just looking at my notes. Sorry, guys. Oh, yes, that's right. So you should just breastfeed or express to the normal amount you would. So this is different from the previous advice. So in the previous advice, we would have suggested, and I suggested this, but you know, we're all learning, so this is the new. But what you shouldn't do is roughly massage the area, which we used to tell you to do. Don't apply anything else to try and dislodge anything. So I might have said to somebody using an electric toothbrush or a comb, do not be doing that. That will just damage the breast tissue further and may cause worse inflammation. So no heat, no massage, no toothbrushes. I'm looking at my notes again. Sorry, guys. Oh, yes. The other thing we used to say was we wanted you to drain the breast. And now fresh research has suggested that that's not actually helpful. It will cause more milk production and that may make the inflammation worse. So just breastfeed or express the normal amount that you would do. Okay, so when should you seek medical help? So if the symptoms that I've described, so you've got a swollen tender patch on your breast, you've got, you might be feeling a bit poorly, kind of ill, under the weather kind of feeling. If you do those things we've just talked about for 24 hours and you feel better, there's not necessarily a need for medical assistance. If you do it for 24 hours and you don't feel better, ring 111 or get a GP. That's a UK thing, but see your doctor. If you are developing a fever, if you are seeing that the area of difficulty on your breast is getting bigger or it's getting redder or you're getting streakiness on your breast, if you are starting to develop a fever, seek medical help. Occasionally, and this is really rare, but it can happen, occasionally mastitis can develop into sepsis, and that is an emergency. So signs of sepsis would be you feel really unwell, you feel dizzy, you feel nauseous, or you're vomiting, or you have diarrhea, you feel confused, you feel really unwell. In that case, do not mess about. Ring for an ambulance or rock up to A&E. But that's rare, like I said. But it's just useful to know that the things that we used to tell you about what to do if you think you have mastitis, the self-care measures, things you can do at home, those are shifting and have changed. And that was in 2022 that started to change.